Namaste. Warm greetings on behalf of Sri Balaji Vidyapith. Welcome to the fifth episode of Channel 1. The last few months have underscored certain noteworthy qualities of the human race. Our capacity for endurance and our ability to launch organized, efficient, and large-scale responses designed to tackle threats to our very existence. Humanity is now facing an unprecedented challenge with communities and economies all over the world affected by the relentless COVID-19 pandemic. The comforting news is that the world is coming together to fight this pandemic. Various governments, organizations, industries, sectors, and individuals are exhibiting exemplary teamwork while responding to this global outbreak. It would be pertinent to state that tertiary care hospitals serve as nerve centers in this coordinated war against the coronavirus in collaboration with the primary health centers and the government. Similar to hospitals all over India and the world, SBV and its constituent hospitals have also implemented strategies to handle this public health emergency in collaboration with local government, primary health centers, and NGOs. In this context, I wish to share with you the experiences of SBV and its constituent hospitals with regard to COVID-19 prevention and control operations. Integrated Disease Surveillance Program of the Government of India has recently acquired great significance in view of the ongoing COVID-19 pandemic. MGMCRI, a constituent hospital of SBV, has joined hands with the local government in implementing this program for the larger benefit of the community. We have been conducting regular border booth surveillance at checkposts in order to screen people for symptoms of COVID-19. A well-trained, multidisciplinary team is in charge of this endeavor. People with symptoms of COVID-19 are referred for appropriate management to designated COVID-19 hospitals and units. In addition, MGMCRI has been a part of COVID-19 surveillance management at the Emergency Control Room, Cuddalore. Case-finding community surveys are considered vital measures towards the containment of the pandemic. These community surveillance activities are a huge undertaking that involve house-to-house screening of individuals. SBV is playing an active role in this regard in collaboration with primary health centers. We have deployed a large team of healthcare workers who screen the public for symptoms of COVID-19. We have also been assisting the government in mass throat swab sample collection. Enhancing public awareness about COVID-19 and promoting preventive measures to break the transmission chains are of paramount importance, especially at a time when community spread is assuming menacing proportions. In this regard, SBV has supported the civic authorities by conducting several information, education, communication activities in semi-urban and rural areas. As a spontaneous gesture reflecting our corporate social responsibilities, workers of several small-scale industries have been screened for symptoms of COVID-19 by our constituent hospitals. In view of movement restrictions due to pandemic, the community seeks alternative methods of getting in touch with healthcare professionals. It is imperative that the medical profession reaches out to the public during such dire circumstances. SBV has introduced a 24/7 telemedicine clinic hotline wherein patients can reach us from their home via telephone and social media platforms and benefit from virtual consultations. SBV has also launched Mind Clinic, an exclusive helpline that provides a safe channel to express psychological distress and receive professional advice with regard to stress management and coping strategies, especially in connection with the ongoing pandemic. We have developed an exclusive brochure that describes basic stress management and coping strategies in simple language for the larger benefit of the community. In the same context, MGMCRI has participated in a teleconsultation and awareness program on child care and maintenance of general health in COVID-19 circumstances. Beneficiaries from several districts of Puducherry and Tamil Nadu raised health-related queries and received vital guidance. Real-time PCR testing facilities for COVID-19 has been started at MGMCRI after accreditation from NABL and approval from ICMR. Our hospital is among the few private institutions in Puducherry to offer RT-PCR testing facility for COVID-19. Distribution of a comprehensive, cost-effective COVID-19 home care kit was recently launched as a unique endeavor with a view to extend help to convalescent patients recovering from COVID-19 at their doorstep, especially in the underserved areas. I would like to take this opportunity to acknowledge the contributions of various members of the SBV family towards the efficient orchestration of our community-based response to the COVID-19 pandemic. I now invite Dr. Nirmal Kumar, the Medical Superintendent of MGMCRI, our flagship healthcare center, to highlight the COVID-19 strategies launched within the hospital premises.
Dear listeners, greetings from Mahatma Gandhi Medical College and Research Institute Hospital. I, Dr. Nirmal Kumar, heading the hospital, would like to brief upon the initiatives taken by MGMCRI to battle the ongoing pandemic of COVID-19. Based on the trending disease pattern of pandemic across the globe and in our country, we had aligned with the regulations and directives of Ministry of Health and Family Welfare, New Delhi, and also had adopted the initiatives of Government of Puducherry. Core committee was formed involving key stakeholders with brainstorming sessions happened to derive the policies required to treat COVID patients with larger interest towards the safety of every healthcare workers of the hospital. Heads of the Department of Internal Medicine and Pulmonary Medicine were appointed as nodal officers to liaison with Government of Puducherry and oversee the in-house procedures of the hospital. Faculty members, residents, nurses, and other support staffs of the hospital were sensitized and trained with COVID-19 treatment protocol. Awareness was created amongst healthcare workers on the safety measures that need to be adopted in the hospital. Hospital had created dedicated wards, 200 beds in general and private, level 3, 10-bedded critical care unit, operation theatre to perform emergency and elective surgeries for patients diagnosed with COVID-19. Flu clinic was started to screen all patients attending to MGMCRI for COVID and its symptoms. This had enabled us to identify and segregate patients on high suspicion of COVID. Virology lab was established as per the standards of BSL-2 to perform RT-PCR 100 samples a day, which is considered as gold standard tool. CT scan screening of the lung with 128 slice machine had proven and added great value towards grading the signs of pneumonia. These testing and screening facilities had not only contributed in early detection but also had eased out the challenges in treating and the outcomes of treatment. Government of Puducherry had designated MGMCRA as one of its COVID care centers with dedicated 150 beds to treat patients with mild to moderate disease. Hospital had offered the benefit of picking and dropping the patients to their doorsteps, considering the safety and well-being of patients. Patients were appropriately treated in the designated COVID wards according to their severity of presentations. Apart from the standardized treatment, patients also have an option towards wellness program like yoga therapy, music therapy, and psychological counseling, which has proven to be effective. Research related to pneumonia, its diagnostic, infection control rates, response to medication, treatment outcomes, and mental assessment are on progress to contribute towards the scientific advancement and societal obligation in COVID-19. Prime focus is being given to conserve the medical and human resource required to face the hardship days in handling the ongoing pandemic during its peak when intensified. Rise in the number of positive cases both in Puducherry and our neighboring district of Tamil Nadu, with high percentage of healthcare workers being exposed and infected, are the real challenges needing to be addressed by us as a team. My appeal to all, from common man to healthcare workers, would be to take care of them both at home and at workplace. It's our duty and responsibility as a citizen to protect ourselves and our kith and kins by adopting the regulations of the government in eradicating the ongoing pandemic of COVID-19. My heartfelt appreciations and regards to the administration, core team, and my dear healthcare workers of MGMCRA Hospital for their continuing tireless support in the ongoing battle of COVID-19. Stay safe and take care. Thank you.
Thank you, Dr. Nirmal Kumar. I would like to emphasize that prevention is of paramount importance. We can reduce the chances of being infected or spreading COVID-19 by taking some simple and standard precautions. All these have a sound scientific basis and have been highlighted extensively by various authorities such as the World Health Organization, the CDC, and the media too. However, it is worth reiterating and emphasizing the salient points, especially in view of the rapid rise in number of COVID-19 cases in recent times. Regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water. Maintain at least 3 feet distance between yourself and others. Avoid going to crowded places. Avoid touching eyes, nose, and mouth. Practice appropriate respiratory hygiene. Stay home and self-isolate, even with minor symptoms such as cough, headache, mild fever, until you recover. If you have a fever, cough, and difficulty breathing, seek medical attention, but call by telephone in advance if possible and follow the directions of your local health authority. Keep up to date on the latest information from authentic resources. According to the World Health Organization, masks should be used as a part of comprehensive strategy of measures to suppress transmissions. Medical masks can protect people wearing the mask from getting infected, as well as can prevent those who have symptoms from spreading them. In the words of WHO, Be safe from coronavirus infection. Be smart and inform yourself about it. Be kind and support one another. God bless you. Jai Hind.